Hello, everyone. Welcome back to this week's Cedarville Stories Podcast. I'm Mark Weinstein, and joining me today is a young pharmacist who is making a significant impact in her profession and for her patients. I'm talking about Rachel Burgoon, who earned a Doctor of Pharmacy degree from Cedarville University and developed a new diagnostic tool to help physicians identify and treat drug-resistant infections more effectively. Today, she is a clinical pharmacy specialist at the Medical University of South Carolina. So let's go to my conversation with Rachel Burgoon on this week's Cedarville Stories Podcast. Rachel, it's great to have you on the program today. Thanks for joining us. And I know that you're originally from the state of Maryland. So
yes.
How does a Maryland girl find Cedarville University to do her undergraduate, then her graduate studies?
Yeah, that's a great question. So back when I was looking for colleges and universities and kind of exploring what I wanted to do with the rest of my life, I stumbled across Cedarville because my pastor's daughter actually attended Cedarville. She went to the School of Nursing a few years before me.
Okay.
I knew I wanted to pursue a degree in pharmacy, and I knew that Cedarville was starting their pharmacy program. So my dad and I went up for a weekend, visited the School of Pharmacy, did an interview there. And I really just loved the campus. I loved the people that I met.
Yeah.
In pharmacy, a lot of programs, you have to do 4 years of undergrad and then 4 years of graduate school. And, besides just the people that I met and the culture and everybody influencing us in like a godly way on Cedarville's campus, I also really love that I could kind of condense my schooling into 7 years versus 4 years of undergrad and then 4 years of graduate school. Yeah.
So when you said you stumbled on to Cedarville, how did you stumble on? How did you find us?
Yeah, I mean, it was really through my pastor at home, his daughter, who went to the College of Nursing. Yep. And I think that she was the only person that I knew who had gone to Cedarville. So when I moved out there at 18, I really didn't know anyone. Eventually, a roommate came. We grew up together, and she came to Cedarville, and we were roommates. But other than that, I really didn't know anyone there, and I had never lived or been in Ohio before. So I really did stumble upon it.
Well, we're glad you did. And so you earned your bachelor's degree in pharmaceutical science. Then later you earned the PharmD through the School of Pharmacy.
Mm-hmm.
I'm curious. So the fact that you were an undergraduate student and then a graduate student, is there much difference from your perspective of being an undergrad compared to a graduate student?
Oh, yeah, there's a big difference. I think that the School of Pharmacy program, though, is unique because you kind of have your fourth year where you're still an undergrad student. Your friends are still on campus from undergrad. So that fourth year is really like a transitional period where you still have your undergrad friends, but then you're also taking graduate school classes. So I really did appreciate that I had that fourth year with my friends before everybody, left, and then kind of getting into the mindset of grad school. But I guess there really aren't that many differences. All of your classes are in the health science building. I definitely met new friends when I was in graduate school, and a lot of us lived off campus. But for the most part, you really do still get to enjoy, all of the undergrad activities and things like that. I was still pretty actively involved and was actively involved in, it was called SCAB. When I was there, I was one of the front desk workers.
Okay.
So I had a lot of friends. So I still felt like I was pretty connected. But you do have most of your classes just in the health science building.
Okay. So when you think back to your days as an undergrad and a grad student, what are some of your favorite memories?
Oh, anything with my friends. I feel like there were always activities on campus, movie nights that we were going to, plays, shows. And honestly, some of my best memories from grad school are just my friends and I studying late nights, trying to memorize all of the questions for the exams and answers, and us kind of just like goofing off and having fun while learning.
So you mentioned, obviously stumbling on to Cedarville. How did you stumble on the career of pharmacy? When did pharmacy really become something that you knew you wanted to pursue?
No, that's a great question. I knew in high school, I really loved science. It was any science class that I could take. It was one of my favorite things to learn about. I thought I wanted to do something medical. maybe nursing or pursue becoming a medical doctor. And then I realized quickly on that I get very woozy and I don't like, I don't like the sight of blood, things like that. So then I was trying to, research maybe more health related careers that didn't involve as much direct patient interaction. And that's kind of when I discovered the role of a pharmacist. And I think back when I was in high school, I thought of a pharmacist at, a CVS or a Walgreens,
Sure.
something like that. And then once I started pharmacy school and really discovered all of the different kinds of careers you can have as a pharmacist, I mean, you can do ambulatory care where you do have patient visits. You can work at CVS. You can work in a hospital and industry. And so I think that aspect really, kept me going and intrigued me to continue to pursue a career in pharmacy. But if I'm being honest, when I was 18 years old, I don't think I knew what I was getting myself into, but it has obviously worked out and I really enjoy what I do.
It has worked out from what I've read. So you took me down my next question. The pharmacy profession is more than just a pill counter. Today, pharmacists actually are integral to the healthcare profession. But you chose the track of infectious disease. What drew you that way?
Yeah, honestly, one of my professors at Cedarville, I think he is still teaching, Dr. Zach Jenkins. He's our infectious diseases professor. And I just remember when I started that module in pharmacy school that those classes just kind of clicked for me. I understood the material. I liked the way he taught. And I knew that it was something I wanted to pursue. And, I went to him and kind of talked to him about that. And he was really, really integral in setting me up with a pharmacist that I could shadow at one of the hospitals in Dayton, who's an infectious diseases pharmacist. And I got more involved with research at their hospital and just continued to love it and do research and learn more about ID. And just, I never really stopped liking it. So I just continued to pursue it.
Yeah. Dr. Jenkins and I worked closely together during COVID because he was our university expert on COVID and infectious disease and did a fabulous job talking with the media. And you have a great role model in following his guidance. So as you think back to your Cedarville education even more, how did it shape you or shape your approach to clinical pharmacy and research?
Yeah, that's a great question. I think Cedarville did a fantastic job at setting us up in graduate school by introducing us to research, having us work in group research projects over a 3-year period. So we really were able to work as a team and learn together and see what it takes to develop a research idea, implement it, write a paper about it. And my team was actually able to get it published towards the end of our graduate training. So, it was nice to have team members there with you learning and also having a professor by your side guiding you through it. Because when I decided I wanted to pursue residency, one of the requirements for your residency program for a pharmacist is to complete a research project. So I had already done it before. So it helped me transition to be able to do it as a resident.
Okay. So earlier on the podcast, you mentioned when you were looking at Cedarville and you were here, the godly examples that you saw, how people treated you was important. So let's move that forward to this question. That is, how does your faith today implement what you do from a research perspective? Because I think it has to play a key role.
100%. I mean, the Bible tells us to love God and love others. And I think that being in healthcare really teaches you that. You are there to love others, take care of your patients. And truly, that's my number one goal as a pharmacist every day is to take care of my patients. I think an amazing thing about my professors at Cedarville is, they prepared us to love others as God would. They also were great examples of what it looks to be in a workplace environment as a Christian and as a healthcare worker. And I truly always felt supported at Cedarville and loved and felt like the professors cared about me and succeeding. And that's truly how I want to convey to my residents and learners that they are supported and loved and I'm there for them. So it definitely made a huge impact in how I treat others, not only my patients, but also my residents and learners.
Hey, it's how you live your life, right?
Yeah. Mm-hmm.
So today you're at the Medical University of South Carolina, correct?
Yes. Mm-hmm.
How did you get there, and what do you do there? What's a day like for you at in this job?
That's a great question. So how I got there, after pharmacy school, or at the end of pharmacy school, I decided I wanted to pursue a residency. And that process can be quite a lot for those who have gone through it. You apply to a bunch of different programs, you travel around the country, because this was before COVID, and interview at all of these different hospitals. And then you basically submit your ranking list and hope that somebody ranks you high and that you match there. So I had actually visited Charleston with my mom a year or two before, and I always said that I would love to live in Charleston. The weather is nice, you're at the beaches, the city's just perfect. So I ended up interviewing at MUSC, ranked them, and then I happened to match with their program for my PGY1 residency. And then I always knew that I wanted to pursue a career in infectious diseases, and they had a second year program in infectious diseases, and I was lucky enough to be able to early commit and stay on for a second year and specialize in training there. And so I've been there, I think, full time since I graduated, maybe 3 years now. And currently I work mostly with our transplant infectious diseases team. So a lot of that, I guess a typical day would be me going into work, looking at my patient list, seeing what interventions I can make as a pharmacist, whether that's changing antibiotics, making sure dosing is correct. I then talk with my attending about the patients and kind of talk through a treatment plan and ideas with them. And then I also can go into the rooms and speak with the patients if they have questions about any of their antibiotics and things like that. And that's kind of the clinical portion of my day. Because I am also an antimicrobial stewardship pharmacist, I do a lot of protocols and guideline updates, and basically just trying to make our system as stewardly as possible, use our resources in the best way that we can to benefit our patients.
Sure. So when you're meeting your patients, is this kind of like a hospital setting, or is this a...
Oh, yes. Yes. So it's patients who are admitted in the hospital, and, they can be ICU patients on a general ward. So lots of different variety and acuity of care and how well the patients are doing. Yep.
So in your experience as a pharmacist post Cedarville, has the profession of the pharmacist always been closely tied to the medical profession? Because that's relatively new.
I think it probably depends on the area of the country that you practice in. I did most of my student rotations in Ohio, and we definitely worked closely with the medical residents, students, fellows. And where I am now, same thing. We work very closely with them. I talk to my physicians and my fellows throughout the day, very interdisciplinary. They definitely respect our opinion as pharmacists and look for us for expertise.
Good.
And again, that's another part of the job that is very fulfilling, is being able to be a resource for others and collaborate with them.
Let's move on to your work and your research. From a story that I read that was written by a Cedarville public relations student writer, I learned that you have an interest in tackling antibiotic resistance and drug-resistant infections. So how do you go about working on that? And what does that all mean? That's pretty technical.
Yeah, lots of big words there. So as an infectious diseases and antimicrobial stewardship pharmacist, a lot of our job is helping other teams who aren't as specialized in infectious diseases kind of tackle antimicrobial resistance and organisms that aren't necessarily able to be treated with some of our more common antibiotics. And, another part of that is also making sure that our patients who need broader spectrum antibiotics get those quickly, and patients who do not need an antibiotic that's covering too many things, that they can get a more narrow antibiotic soon. So there really is a balance of making sure, patients are treated, but not over treating them. So that's kind of where we come in as infectious disease and antimicrobial stewardship experts, is looking for different risk factors, interpreting cultures in order to get those patients on those antibiotics.
Yeah. So this is probably a simple question based on what you just said, but so why is this kind of research and work so vital to healthcare today?
Because if we keep continuing down the road of increasing resistance, then we probably won't have the antibiotics that we need to cover these more resistant infections, these serious infections. So in order to help cut back down on resistance, getting people on narrow spectrum therapy when possible is really key to help combat that.
In that story that I alluded to just a little bit ago, I learned that you created a new risk tool for treating drug-resistant infections more rapidly. Tell us what the tool is, how does it work, and what successes have you seen from this tool?
So it really is a bedside tool to help identify something called an extended spectrum beta-lactamase infection quicker. So there actually are a few of these tools already out there. Some of them are for specific infections, like somebody with a urinary tract infection, versus mine looked at people who are at risk for infections that are not urinary infections. So basically what we did is we looked at all of our patients who had an extended spectrum beta-lactamase infection, and we went back and chart reviewed to see what factors, risk factors they had in common with one another that potentially could have led to them getting this infection. And so the tool really is something to be used at bedside, where a provider can quickly look at the patient's chart, see how many of these risk factors that they have, and if they have a certain number of risk factors, start them on the broader spectrum antibiotic quicker.
Okay. So how did you go about creating this tool?
So we modeled it off of some of the other tools that already exist, but it was part of a residency research project. So again, kind of going back to project development and project management, and coming up with the question of what I wanted to solve, figuring out how to do it, and, data collecting and chart reviewing. And it was part of the residency program. So I definitely had lots of mentors who have done these sorts of projects before help me with it.
How does the tool work?
Mm-hmm. Yeah. So again, I think it's 4 or 5 questions, looking at different risk factors that your patient might have. So if a provider has a patient who's really sick in the hospital, they can look at the patient's chart, see if they have any indwelling lines. That's one of the risks. Okay. See if they've ever had an ESBL infection before. That's another factor. And they add up all of their different risk factors. And if they meet a certain threshold, then they would kind of be cued to start a broader spectrum antibiotic on that patient, because they were looking at the risk factors that we identified that led to an increased risk of an ESBL infection.
So was it a year-long project to develop this, or how long did it take to create this tool?
Yeah, so I started my second year of residency during my infectious diseases focused year, where we made the risk scoring tool. And then the second part of the project was then validating it, going back and making sure what we collected aligns with the patients that we're seeing in our hospital. So the second part, and the article that she wrote, the article about, was actually me mentoring our pharmacy resident, and she went back and used my tool to validate it in our patient population. So that took another year.
Rachel, since the tool is relatively new, I assume there are steps you need to take before it gets officially used. What are those steps, and where are you in that process?
Great question. So in order to be able to use this in our hospital system, and how most hospitals work, is you need to go through a set of different committees to get it approved. So at our hospital, we would need for it to go through a subcommittee and then our larger overarching P&T committee. And then after that, you would need to do education to the providers who are going to use it, show them how to use it, show them why it could be beneficial, how it could be beneficial. And that's really, you do the work and then there's a whole nother process to get things approved and educate and implement. So we're kind of at the tail end of us creating the process and starting the how do we implement this into our daily workflow.
And how have the physicians responded to this tool?
Yeah, so our ID physicians who are on the project, I think they think it is a great tool. Like I mentioned, we are working on rolling out and how we're going to show this to people. So we haven't gone quite to that step yet to see how providers will use it. But a lot of the pharmacists and physicians seem excited about it.
Does it need FDA approval or any approval at the federal level?
No, it's more like a quality project initiative. And again, that's a large part of my job is coming up with different quality improvement initiatives and getting them more internally improved through the hospital.
Okay. Once it's done, it will provide a valuable tool that will help healthcare, right?
I believe so. I believe it will help our hospital and our patients and our physicians. Yes.
Will it be solely used at your hospital or could other hospitals buy into it?
The way that this type of resistance works is in different parts of the country, there could be different risk factors or different types of resistance. So most of these types of tools are really mainly used internally, but it is published. So other institutions could do something very similar to what we did. And because we published it, hopefully, other institutions will be able to duplicate what we did for their specific patient population. And if they do have a very similar patient population, they could also probably validate it for their own use.
Okay. That'd be pretty neat to see, not just your hospital use it, your pharmacists and your medical professionals, but others, and really serve as a valuable resource to help healthcare. So in infectious disease today, what are you seeing as the critical issues facing that area for pharmacists?
Critical issue. I mean, I feel like there's always room for new drug development. I think there's a lot of new antifungals in the pipeline that are coming out. And I think really my role as an infectious diseases pharmacist is going to be becoming familiar with these novel drugs, understanding how to get them, what patients to use them in, and hopefully treating our patients with newer and better antifungals and antibiotics.
Rachel, we are about out of time. I have a couple of questions I want to wrap up with. And one is really, what, as you think about your career and you think about the pharmacy profession and you think of students coming behind you, even here at Cedarville School of Pharmacy and other pharmacy schools, what advice would you give those students or young professionals who are interested in research and infectious disease or any aspect of pharmacy?
I would tell them that it has been a great career path to me, and I think that it is a great career to choose. There are so many different aspects and avenues of pharmacy. Even in the world of infectious diseases, right now I practice in the hospital and I take care of patients who are in the hospital, but there's clinics where you can work in the outpatient setting. You could go into industry and pharma. And really, I would just encourage people to pursue their passions and what they're interested in. That's truly all I did is I found something that I liked and I continued to seek out mentors who I respected and asked for their help. And they were, more than generous and grateful and helped me get where I am today. So I would just continue to encourage students to pursue their passions. And then also when you get to the point where you've accomplished what you have, look back at, and thank all the people who helped you get there and also turn around and give back to others. And that's kind of what I'm trying to do now. I'm trying to be able to mentor my students and residents and help them get where they are because people did it for me.
So obviously you're a product of Cedarville School of Pharmacy. Do you believe there's an advantage for you to go to a Christian university like Cedarville to get a pharmacy education unlike, I mean, you can go to any school probably and get a good pharmacy education, but does Cedarville maybe stand out because of the added focus on faith in Jesus?
To me, it did, for sure. I think that I was surrounded by people who believe the same things I do, wanted me to succeed, truly cared about me. And I think that was, the best experience I could have ever had, especially when you're going through graduate school training and like a time of life where you have a lot going on and you have a lot of things going on and you need the support. Knowing that I could go to a professor and, ask them to pray for me or with me because I needed them at that time was something that I valued very highly in my education.
That's a great point. And let me encourage anyone watching or listening to this program today, if you're interested in a career in pharmacy or healthcare professions, which Cedarville is very well versed in with high quality faculty members, I encourage you to visit Cedarville's website, cedarville.edu, and learn more. Even come out for a campus visit and see what you can learn. It's a great place. Rachel, my final question to you really bridges everything that we talked about today. We talked about pharmacy. We talked about your education. We didn't talk a lot about your personal life, but how are you able to balance a career in pharmacy with a very important job? You're a young wife. How do you balance work-life responsibilities?
One day at a time. My husband is very supportive. He's very kind. And I met him while I was in residency. And so he kind of saw me go through the long hours and he has always been supportive of me. So he's a big support in my life, my friends, my family. Two of the girls that I went to pharmacy school with, we talk every single day to each other. We're all pharmacists and, we kind of bounce ideas off each other, say what we're going through, not only at work, but in life. And I can't value my friends and family more. They're amazing.
Who are those former students?
Oh, shout out to April Chapman and Julia Gardner.
Rachel, I really enjoyed getting to know you a little bit. I really appreciate what you're doing in the pharmacy profession, especially because you're doing it from a Christ-centered perspective. So I encourage you to keep moving forward. And thanks for joining me this week on the Cedarville Stories Podcast.
Well, thank you for having me.
Thank you for listening to the Cedarville Stories Podcast, brought to you by Cedarville University. Be sure to come back next week when we'll share another Cedarville story for God's glory.